Hello, I'm Rob Walters, and welcome to our next edition of Word on the Street. Today, my guest is one of our newest members with Six Rivers Media, our dedicated healthcare reporter, Joy Mazur. Joy, welcome to Six Rivers Media, and tell us a little bit about yourself, your background, and what do we need to know about you?
So I originally come from Chicagoland, about 40 miles west of Chicago. Not Chicago proper, but I went to school in Missouri, University of Missouri, where I got my bachelor's degrees in political science and journalism, and also a Master of Arts in journalism. And then most recently, I worked for about half a year in DC, doing, among other things, I was interning in Congress, so that was really exciting.
Wow, what were you doing?
I was interning for Punchbowl News and covering congressional lobbying, a few nomination hearings, talking to lawmakers.
Cool.
Yeah.
So you've been with us for a few weeks now, so what have you learned about the region?
So on the health beat, there's a lot going on.
Yeah.
There's a lot of people who are very passionate about health here. And the obvious issue is ballot and the COPA, which people are very passionate about on all sides. So that is a really big thing. And there's also a lot of different things that I'm watching in terms of, post-Helene. There's a lot of health issues there that could be covered. Mental health, things that tie in with, homelessness, addiction. That is a really big aspect as well.
You mentioned the COPA. You recently wrote a story about that. Can you refresh our memories about what that story said?
Yeah. So that story was more, it was kind of on the absence of a thing, I guess you could say. It was about how there hasn't been a public hearing on the COPA for over a year, or almost a year now, since it was originally scheduled. The Tennessee Department of Health schedules kind of annual public hearing on the ballot health merger. They originally had that scheduled for last July. Then they pushed it back to November. Then Helene happened, so they, said they were going to reschedule it. Now it's been over half a year since November. Still haven't rescheduled it. So just kind of, watchdog journalism to focus on, hey, hasn't happened yet, and kind of just pointing that out.
Tell us what the word COPA means.
Yeah, so that is a certificate of public advantage. It is basically that is the Tennessee version. There's a Virginia version as well, because Ballot Health does do some work there, which, not off the top of my head, can't remember what they call it, but yeah, so that is a state-sanctioned monopoly of sorts, specifically on inpatient beds. That Ballot Health was a merger between two other systems, and so now they operate most of the hospitals, and they're the largest healthcare system in this area, and I believe as in the nation as well.
Talk to me a little bit about some of the stories you've written.
Yeah. So most recently, I did a story on dental providers and the dental provider shortage here, which is kind of a multifaceted issue. There are dental providers in the region, obviously, but according to federal data, the counties in Northeast Tennessee don't have a lot per 10,000 people, say. And also a lot of dentists and dental clinics do not take Medicaid, so they don't take TennCare, which can be an issue for a lot of people. So that is kind of, just an overview on that issue and how multiple dental clinics are approaching it in the area. There's a lot of great growth in that area as well. Kingsport Dental Clinic that is trying to, ameliorate that situation and train more people here so that they stay in the community.
Talk to me a little bit more about some of the other health issues you're learning about.
Yeah. So there's, I kind of view it as a big tree with many branches that all connect. I think health is an issue that underlies everything, and really anything can be a health issue. So the big one, which I kind of just touched on, is insurance. That's one that really overshadows every other branch. So, Medicaid is a really big issue, TennCare for a lot of people, and something that in a timely sense might be changing soon, and so that may affect people. And then there's also the provider side of that, which insurance companies will reimburse providers. So how do providers deal with that? Are they being adequately reimbursed? So insurance is a really big umbrella. Mental health, which I also talked about a bit, that encompasses a lot of different things. I think now most people, feel that is synonymous to anxiety and depression, but there are so many different things that fall under mental health. Again, with Helene, there's a lot of strain that comes, mental strain from, repairing the area. Mental health, then there's disability is another big issue, and that encompasses intellectual disability, mental disability, physical disability. And then there's the actual just different aspects of healthcare itself, and different illnesses that people will have. There's cancer, and how does cancer care work here, different sorts of things that fall under that, dentistry, vision. So there's a lot of different branches. Those ones are top of the dome. But
let's talk about children. Didn't you just write a story about a report that came out?
Yeah. So children's well-being, there's an annual report done by a private philanthropy that they put out every year, and so Tennessee ranked as one of the worst in children's health in particular. It's ranked middle, within kind of the middle range for children's well-being overall, because there are some other factors like economic factors and family and that sort of thing. But as far as health, not doing so great in comparison to other states, unfortunately. And that includes like children and teen deaths, things like that.
It's important that we get those stories out there. Yeah. So we've talked a little bit. Let's talk about another hat that you're wearing. You've recently been named managing editor of Six Rivers Media. Puts out twice a year a magazine called Healthy Living. Talk to us a little bit about Healthy Living and what the vision is for that publication.
Yeah. So I think that is something that something I'm really passionate about is serving the community in a way that is helpful to people. I mean, I think there's a lot of journalism is a lot of the time doing really great reporting that is, investigative or accountability, but I think sometimes people want to read something and know, how can they maybe, how can they work through their insurance issues, or what are some areas nearby that they can use to be healthy, and things of that sort. So that is going to be really community focused, something that people can read and apply to their everyday life, as well as just I think showcasing there are a lot of issues with healthcare that I think people think of, but there's a lot of really positive growth as well.
Talk to me. I know you were working on a story about organ donations. Talk to me a little bit about that, and how can people, if they have thoughts about organ donation, how can they get it? How can they reach you? How can they contact you?
That's a story very very much developing. So still would love to have community input. That is I'm looking right now at how organ donations here in this region of Tennessee match up to either state or national organ donations, and just kind of an overview on that issue. My email is Joy Mazur at sixriversmedia.com. Can be found on any of the websites, specifically Johnson City Press and Kingsport Times News. And yeah, I would really love input and feedback from the community on that issue as well as all others.
Sure. And you're out and about, and you visited all 5 newsrooms, and can you talk a little bit about what you've seen in the different areas?
Yeah. So I think, I mean, and you know, coming from not from here,
Right.
you know, it's been really great to be able to visit all the towns, and Kingsport and Johnson City, obviously very lively places, lots of action, as well as those are our daily newsrooms. So there's a lot going on an everyday basis, and Irwin, Jonesboro, and Mountain City, where our other newsrooms are, first of all have really fantastic offices with beautiful skylights, which I would love to have in Johnson City. But, you know, they also have a really great pulse on their individual communities. And I think those are, you know, smaller communities than Kingsport and Johnson City, but, you know, they have really great you know, culture is there as well, and each of those have really individual, you know, I think health issues, as well as some of those were, you know, Irwin in particular more heavily affected by Helene, especially the hospital, and so I'm really excited to work with them. I, you know, just really want to emphasize that I am very committed and want to you know, really get out there in the community, and I want to know what people want from the news as well, because you know, we're the gatekeepers of what gets written about and what, you know, the community knows about, and so I think it's really important to have that two-way street and get feedback from people as well.
Well, excellent. Joy, thank you very much. I appreciate it. And we'll see you next time on Word on the Street.